Okay, welcome to video number 11. This is immune support. So this video will be on the immune system. And like all the others, this is one way of doing things, especially in this topic. There are so many things that we're not going to be able to cover. Just trying to give you enough to get you started. And there is a lot of research that supports natural health care to support the immune system. GI health is probably one of the most important things in dealing with the immune system. About 70% of the immune system is associated with the GI. Ask your patients about courses of antibiotics, and we'll get into this a little bit later. Often probiotics they've improved COVID outcomes and even cut down on severity of colds and flu and there's a definite GI connection. The other thing to consider is diet. Diet both helps with inflammation and helps balance the microbiome. And I threw this slide in there because lifestyle really, really does matter. I remember I saw a 5-year-old once had 2 ear infections a year every year of his life. Came in with some kind of purple juice-like drink and Ritz Bits, and we stop that pattern simply by changing the diet. So always look at your patient's lifestyle. When talking about the immune system, we're also talking about inflammation. You have to realize that a lot of the symptoms of an infection are not from the bug itself, it's from chemical warfare being waged by your body. White cells produce inflammatory proteins like cytokines. They're trying to destroy the invader. So it's chemical warfare down there. When we talk about all the deaths from COVID, the virus did not kill the patients infected with COVID. It was the inflammatory response. And 35% of all Americans are walking around in an inflamed state. So when they get infected, they're actually in more danger. So when dealing with a patient with immune issues, who gets sick a lot, remember that you have to deal with their inflammation in general. Of all the glandulars, thymus extract is perhaps the best studied. Thymus extracts have also been shown to increase the activity of T cells and B cells. They have been particularly effective in dealing with hepatitis B. Winona Judd got herself healthy by taking thymus extract. A number of companies have found that general glandular support is also good for the immune system. Zorix makes a product called SOS. It's called Systemic Organ Support. Has an interesting history behind it. George Goodheart used to treat patients with a glandular combination that he put together and used them for people that had depleted immune system. Zorix ended up reverse engineering this stuff and found out that it had a little bit of B12 in it and a proprietary blend of thymus, adrenal, liver, spleen, and stomach glandulars. And we've had practitioners use it for leaky gut, hypo and hyperadrenal stress, and of course immune system issues. Vitamin A is particularly useful for people with especially viral infections, but other kinds of infections too. It's an antioxidant. It protects the cells. It lowers inflammatory markers. A lot of practitioners have found that like a high dose vitamin A for a couple of days when fighting a virus or other infection is especially useful. Infections and chemical exposure deplete vitamin A levels, and some practitioners have found that a dose as high as 200,000 IU for a day or two is really effective. Vitamin A is an antioxidant as well as antiviral. A number of animal and human studies have shown it to be an effective antiviral. It powerfully supports the immune system, but it can be toxic in high doses. This is why lay people, please don't dose yourself with vitamin A. The combination of vitamin C and quercetin has been found to be effective in viral infections and also especially with lung issues. There's studies using this combination for COVID patients that found it very effective. And they can even be taken in combination to prevent illness, like during flu season. Quercetin also is antioxidant, anti-inflammatory, and antiviral. It will protect the immune system. And the combination, once again, it's potentiated by adding vitamin C. And vitamin C is found in your white blood cells. It also improves the effectiveness of white blood cells and has also been used in viral infections, found to be very effective. There's a couple of studies there where it's been used for herpes. And here's a study that shows that the combination of vitamin C and quercetin is especially useful for inflammatory changes and infections of the airway. This is why it's also good for your asthma patients. Arabinogalactan is a very large polysaccharide. It's the active ingredients in herbs like echinacea. And in the last 20 years or so, it was found that arabinogalactan can be gotten in large amounts from the larch tree. Studies have found that large doses of it can prevent viral infections like the common cold. Elderberry is another substance that's been studied and found to reduce the number of colds and the severity of colds. T regulatory lymphocytes can be increased by vitamin D supplementation. Vitamin D status has a lot to do with how these things work. Regulatory T cells are white blood cells that play a key role in regulating your immune system. They control the immune response to keep it from overreacting to harmful invaders. Patients with low vitamin D levels have been associated with an increase in inflammatory cytokines and significantly increased risk of pneumonia and viral upper respiratory tract infections. During the COVID pandemic, some researchers found that low vitamin D3 was a predictor of the severity of the infection. So they found that if your levels were above 50 nanograms per milliliter, you wouldn't have a severe case of COVID and you wouldn't die from it. So it's a very important marker to look for and something to check. Vitamin D levels can be checked inexpensively in your patients with immune issues. And there's a lot of other substances that have been found to be beneficial to the immune system. Olive leaf, monolaurin, berberine, and thyme actually help by balancing the microbiome, which is an important part of the immune system. Most companies have one or more immune support products. And the substances we've just discussed, they're all found in Immune Plus. Harry Eidner designed the product, and he was an innovator. He found that he was a very big fan of thymus tissue, which this product has, but he also combined a lot of the herbs and vitamins that are in other products. And usually you see thymus tissue as a separate thing, or you have the immune support things. Harry combined them and made a fairly effective product to prevent, cold flu symptoms, people that get sick. Give them 1 or 2 capsules per day. If they get a viral infection, you can increase it to 4 to 8 capsules per day, and consider adding quercetin and vitamin C. That combination is really, really useful. And there are about as many immune formulas as there are vitamin companies, and you'll find that some work better than others for particular patients. It's almost like an individual thing, but the Immune Plus works very well on a lot of people. Another thing that can lead to poor immune function is the thyroid. There's a lot of hidden cases of hypothyroidism. Look for these other symptoms. They're cold when others are not. They have no initiative. They're fatigue, constipation, high cholesterol, morning headaches. And not necessarily all these symptoms, but some of them. The headaches, they'll get it in the morning. It'll go away as the day goes on. They have trouble losing weight. They might cry for no reason. But thyroid is definitely something you should look at if a patient has immune issues. One of the reasons thyroid issues are missed so often is the TSH is a lot of times the only test that they'll run, and the norms can be as high as 6. But we found that A TSH above 2.5 often is a sign of primary hypothyroidism. Also, you want to look at basal body temperature. Basal body temperature is not a diagnostic thing, it's just an indicator. There's other things that can cause a low temperature, but if it's below 97.8, that's another thing to consider. Also, when looking at the labs, you want to make sure the symptoms are present. If they don't have hypothyroid symptoms, like mentioned in the last slide, then they don't worry about the lab. If T4 is less than the middle of the lab range, that might show a need for iodine and possibly tyrosine, once again in the presence of symptoms. If T3 is below the midline, and also if T4 is above the midline, they might have a conversion problem. T3 is the active form of the hormone, and the body needs to convert T4 to T3. It needs selenium and a few other nutrients to do that. Also, high stress will hurt the conversion, so you want to look at stress and adrenal function in these patients as well. And medicine is finally taking a look at the effect of antibiotics on the microbiome, treating recurrent infections with antibiotics, like bladder infections, urinary tract infections, sinus infections. They actually lead to further infections because of the disruption of the microbiome. There's a few studies there that support that. And also it's something you need to look at. If a patient is getting recurring infections, you need to take a look at the microbiome. Changing the diet to something like the Roadmap to Health, and also getting away from the use of antibiotics by using some of the immune support that we've talked about, will help to begin to change the microbiome in a lot of patients. That's good enough. However, if you don't get the results with the common sense changes, you might need to further address the microbiome. You might need to test the makeup of the microbiome. There's a test called the GI map. There's also testing for leaky gut. You could do the zonulin test. That's been dissed a little bit by some of the literature as not being consistent for leaky gut. They got the lactulose mannitol test. Cyrex Labs does a test, looks at lipopolysaccharides and the zonulin. But you want to see if they've got intestinal permeability. You want to make sure that the microbiome is made up. Of course, I would wait and see if the common sense changes make a difference. If they don't, then you got to dig deeper. And thank you for your time and attention. Anything I can do to help you or your practice, there's my email. There's Zorex's phone number there. And if you order from Zorex, use the code PV10. They'll give you free shipping on your first order. And like I said in the beginning, there's a lot more on this topic. Please explore it further. And our next video will be on depression and anxiety. 17% of the population takes antidepressants.